This is Dr. Betty Rabinowitz, NextGen's Chief Medical Officer and Principal with NextGen Advisors. Welcome to our podcast. The COVID pandemic has been the focus of so many of our recent podcasts and blogs, mostly covering the implications and impacts of this devastating pandemic. Today, we're going to look at the pandemic from a slightly different angle. My colleagues Graham Brown and Dr. Marty Lustig are here with me today to search for the silver lining in the pandemic, exploring whether there have been positive aspects to this terrible pandemic, and if so, what those might be. Hello, Marty and Graham.
Hello, Betty.
Hi, Betty. It's great to be here.
Marty, the CDC is reporting that influenza rates are significantly lower than the usual rates by this time of year. What are some of the drivers for this decrease?
Yeah, I really do think this is an important silver lining. We would be in a much deeper hole if it weren't the case. There are a few factors that have contributed. One good news is that vaccination rates have been better this year for the flu compared to prior years. I think the latest statistics show about 188 million doses of flu vaccine have been distributed this year, which is like 20 million shots more than a couple of years ago. So that's a great statistic. Clearly, the measures that we're taking to protect ourselves from COVID-19 are also protecting us from the flu. So whether it's wearing a mask, social distancing, frequently washing our hands, all of those things I think are making a significant difference. And then the other factor is for me both schools and congregate living, which are both clearly associated with spread of influenza. With kids not going to school in large parts of the country, it's, I think, reduced the spread of influenza. And because of the measures that have been taken in congregate settings, specifically nursing homes and other group living environments, I think that has reduced the spread as well.
Absolutely. The crisis has exposed flaws and gaps in the American public health infrastructure and capabilities. Graham, I'd be interested to hear your thoughts. Clearly this reality has significantly impacted our ability to respond to the pandemic effectively. Is there any silver lining to be found here?
I think there is indeed a very powerful silver lining, but it comes from the experience of having watched a system fail in front of us in some ways, wherein if we look back at the past year, I think there's much greater recognition now of the role that a highly functioning public health infrastructure could and should have played. When we reflect on how PPE supply was pulled together and then distributed. We think about how testing was rolled out initially in the pandemic and how confusing that was, how problematic it was to get access to testing. Contract tracing is still a very mixed bag. And, now with the identification of new variants and how those are being tracked, vaccine prioritization, all of these areas I think are really had a spotlight put on them, much greater public awareness. So I think that there's going to be really a refocused attention, I hope, on budgets and how these really crucial public services need to get funded in an appropriate way, coordinated in a better way, and bring greater consistency. And I do think that there's so much more in the public realm and public knowledge and sphere of conversation now that ultimately the silver lining is this is going to make us more tuned in to the risks, and that we're going to be able to take actions more rapidly in a more coordinated way in the future to address the evolution of coronavirus specifically or a next pandemic.
Absolutely. The rapid development of the novel COVID vaccines has been one of the most encouraging breakthroughs during the pandemic. What are some of the most promising aspects of this success? Marty?
Yeah, so I think I'd start with the fact that the new technology with the mRNA vaccines as well as just the overall rapid development of vaccines, irrespective of which technology is being used, really sets us up for the future. That I have some confidence that we're going to be able to develop the next needed vaccine now that we have the foundation of producing these. And Graham was talking about public health infrastructure, but I think this is a critical component of it going forward when it comes to particularly infectious threats, that we have the ability to do this going forward. And combined with that, I think the financing of how this happened, particularly in the United States, where there were these partnerships between the government and the pharmaceutical industry to really enable acceleration of this development, is a good model for future challenges that we might face.
I'd reiterate something that Marty said. I think the development that's happened in the past decade on this new mRNA platform was really searching for a target in terms of where we could develop a vaccine that had utility. And the last year has really shown the efficacy of that platform model and how rapidly it can be adjusted and adapted. So that really positions us well globally to think about upcoming and emerging viruses and how they can be addressed. And really, I think in some ways reestablishes the importance of kind of the basic science that's here and the level of collaboration that's happened globally between different pharmaceutical companies and governments.
Yeah, it's daunting to think what would have happened if this pandemic would have hit some years back, where the technology was not ready for prime time. The timing was very fortunate that they were just ready to go. A couple of years back could have been a completely different story. There also has been a lot of talk about the silver lining when it comes to public perception of the healthcare profession as a whole. How do you feel things have changed in this regard?
For me on this one, as I look back to the summer and early autumn of 2020, nightly at 7 p.m. there was this clapping, honking, banging of pots and pans, people playing violins on their balconies in cities in recognition. Lots of signs in people's front yards acknowledging the dangerous situation that healthcare workers were in and how thankful the public was and how appreciative they were for the role that these frontline individuals were taking on. I haven't seen that kind of spontaneous recognition in my lifetime. I don't think we're seeing it as much, 6 months later than we were at the outset, but I think the sentiment is still there. There's a real respect for the healthcare workforce, the dangers that they go through on a daily basis, and how important a role that they play in keeping all of us safe and taking care of us when we need them.
Absolutely. Marty, anything you wanted to add there?
Yeah, a couple of things. One is just as sort of supportive of what Graham's saying. The statistics on people that are seeking education in healthcare, are pretty impressive. With reports that applications for medical school are up 18%, according to the Association of Medical Colleges. That's a huge bump. Reportedly, some schools have seen jumps as high as 30%. So that in itself sort of confirms what Graham is saying, because there's such a positive image. We're going to have a lot more, highly qualified people who want to go into healthcare, and that's a wonderful thing.
That is really very exciting, and actually, when you look apparently at some of the details of who is applying, apparently there is a increased percentage of underrepresented minorities, people of color, students who are choosing to go into medical school, which is particularly exciting because clearly diversifying the American medical school cohorts is a great purpose and accomplishment.
Absolutely.
What have been some of the changes in the way the practice of medicine has evolved with the pandemic that you feel could represent silver linings?
Yeah, I do think it's worth noting a few things. And we've ourselves, as we've talked and listened to providers across the country, we've heard them report silver linings. For most, the shift to telehealth in response to the pandemic is something that is likely here to stay and is viewed by most of the profession as a big step forward. It's also a reflection of a demonstrated ability in the pandemic for healthcare practices to change and adapt quickly to evolving situations. And I think that in itself is a silver lining, as we're an industry that has often been slow in that regard. And then the final thing was, I think the pandemic has created an even greater focus on patient engagement. With the sudden loss of face-to-face visits, providers have gotten quickly creative in trying to stay connected to their patients, and putting the patients at the center of everything that we do. It can only be a good thing. So I think that's a really important silver lining to this.
The thing your last point, Marty, is I think a really important one to me. I kind of view this through the lens of there's been a little bit of a shift to healthcare providers being more proactive versus reactive, right? For a long time, you've waited for the patient to show up in your office with their problem list and need to see you. And given the inability of patients to feel safe coming into care, there's been a really intentional focus in provider practices to say, who are those people who are most at risk? We know them. We see them every 2 months. We know that we need to ensure they're being taken care of, and they're proactively reaching out through a number of different tools, whether it's phone calls or emails or websites or employing telehealth, as you're saying, to be able to visit them in a safe way. And I think that's really been an interesting shift just in the mentality in some ways of where a practice is recognizing they're really crucial to the well-being of individuals in their patient panel, and that they need to do really proactive steps to ensure that those people are safe and are being taken care of. And that's been really reassuring to see.
Finally, I'd like to ask both of you on a personal note. It's obviously been a long, hard year, and we're still facing some months until we're all vaccinated and back to some semblance of normalcy. What, however, have been the silver linings for you personally in the pandemic? Marty?
Well, I'll point to one small one, and that is particularly in the context of being in upstate New York in the winter when we've got a couple feet of snow on the ground, not having to drive to work has been an absolute silver lining. And the ability to connect with everyone that I work with and be able to work from home and not fight the elements makes me think I'm probably never going to go back to an office in the way that I spent most of my career.
Yeah, a couple thoughts come to mind for me. One is, this is going to sound a little cliche, but absence makes the heart grow fonder. And I think about the places that I visited in my life and how yearning I am to go back to them. My family, who's on the other side of the continent and I haven't been able to see, I really look forward with great joy to being able to see my family members again. So those things are, I think, resonating in a way after a year of absence that are probably stronger than they were. And having, spent many years of my professional career traveling every single week, I'm not doing that now. And what I realize is I'm not getting colds. I'm not getting the flu. I'm not on an airplane or, waiting in an airport lounge or at the gate with 100 strangers, touching sticky airline seats. And when I do get the opportunity to go back to travel, I think I'm going to continue to be much more conscious of the protections that I need to put in place to make sure that I'm not getting sick along the way. So I think there's just individual life lessons here that each of us have gained that ultimately are going to make us probably better travelers and get more joy out of those opportunities when they come back to us.
Yeah, interestingly for me, I was traveling almost every week as well, and the biggest silver lining for me has been staying in one place for a prolonged period of time. I feel it's given me an opportunity to focus, to be more productive, to be less exhausted by the mechanics of travel and just really appreciate I've never worked from home. This has been the first time in my career. And certainly I do not miss sitting at 5 o'clock in the morning on a Monday morning on a jet on the runway at the Rochester airport, having green fluid being sprayed on the wings. It's the icing was not one of my favorite activities. So I'm good. To me, that's the biggest silver lining.
We also know that all of our dogs are much happier this year than they might have been in the past because they've got loving parents around them all the time.
Absolutely. Terrific. On that upbeat, positive note, we look forward to return to normalcy sometime soon, but have appreciated the opportunity to review some of the silver linings with you, our listeners, today. Thanks, Graham and Marty, and thank you to our listeners for joining us. And if you enjoyed today's discussion, consider subscribing to our podcast. This is Dr. Betty Rabinowitz with NextGen Healthcare. Have a great day.